Thank you all for attending this training today. We're very excited to have you all here. Way more people than I was expecting to sign up for this, which is always a good problem to have. Um, I'm very excited to present Keith Brothridge. He is with the Baby Fold, and I think he's going to do a little bit more of an introduction of himself. So this is that Adverse Childhood Experiences, or ACEs, and Resiliency Training. This is hosted by BN Parents, which is a substance use prevention coalition in the Bloomington Normal area. So that is the organization I work with. We are through Chestnut Health Systems. So that's probably how you saw this training. And I will have a Survey Monkey that I will be posting in the chat at the end to get certificate of attendance, and some just quick questions about the training should just take you a couple minutes. And we are recording this and we'll post it on the Chestnut website, and I will send that out with certificates of attendance to all attendees that were registered for this event. So without further ado, I'll pass it off to Keith, and we will be monitoring chat and Q&A throughout, and answering those at the end.
Fantastic. Thank you, Randy. Welcome, everybody, as you're jumping on and getting settled. Like Randy said, my name's Keith Brotheridge, and I am currently the training coordinator. I also supervise our foster care therapist here at the Baby Fold. I've been at the Baby Fold for 16 years. The first 8 of those years I spent as a therapy supervisor and assistant director in our residential treatment center, which closed in 2017. But up until that point, I was immersed in the work of residential. And since that time, I have been the training coordinator, really focused on internally at the Baby Fold, pushing out trauma-informed trainings to make our workforce, our staff at the Baby Fold, more trauma-informed, because as a child welfare agency, we serve the folks from the hardest of places, and I'll phrase it that way. We treat a lot of trauma at the Baby Fold, childhood trauma in particular. And prior coming to the Baby Fold 16 years ago, I worked in Northwest Ohio at an agency called Family Service of Northwest Ohio for 15 years as a therapist, as a clinical manager and director. I also facilitated for 12 of those years male domestic violence batterer programs. I headed up our agency's programs with court-ordered domestic violence offender. And certainly working in the realm of domestic violence, I was aware of the impact of trauma, but this was before we really knew how trauma impacted the brain, the body, kind of that mind, body, spirit, if you will. And then I landed in residential for 8 years, and my eyes were open very wide to the impact of childhood trauma. And so I'm going to talk a little bit today. Before I jump into talking about the Adverse Childhood Experiences study, or the ACE study, I just want to kind of lay a foundation of trauma. What is it? What are we talking about here? So I'll do that. I'll talk at length about the Adverse Childhood Experiences study. With that study, you're going to hear about the prevalence of trauma. You're going to hear about the long-term health risks correlated with a high ACE score. And I cannot talk about trauma. Well, I could, but I choose not to. I don't want to talk about trauma. I don't want to talk about ACEs unless I tag on just a little bit about resiliency and strategies to enhance our resiliency. So that is our agenda here for the next 55 minutes. I know Randy had said, if you have questions or you have things you want to say, drop those in the chat. At the end of the training, I can stay on, try to answer as many of those questions as we can, time permitting, but we'll do it that way. I like starting trainings with a quote. I used this last week for the professional group when I spoke last week. And to me, it's a very powerful quote, what speaks the truth. Ultimately, what determines how children survive trauma physically, emotionally, and psychologically is whether people around them, particularly the adults they should be able to trust and rely upon, Stand by them with love, support, and encouragement. Fire can warm or consume, water can quench or drown, wind can caress or cut, and so it is with human relationships. We can both create and destroy, nurture and terrorize, traumatize, and heal each other. And this quote comes out of the book by Dr. Bruce Perry, The Boy Who Was Raised as a Dog. I really, if folks are looking for a resource on childhood trauma, Dr. Bruce Perry is one of the first persons that I would push out to you in terms of his work, the books he's written. Yeah, he is certainly an expert on childhood trauma. And so let's start there. If you were to Google trauma, you'd find a whole bunch of definitions. For years, I have landed on and kind of hung my hat on the definition from SAMHSA, the Substance Abuse and Mental Health Services Administration. And they came out with this in 2014, but when they kind of redid their materials, it still holds true in 2023, the last time that they redid their own materials on the topic of trauma. What I like about this definition is what you see in bold, the three E's. Trauma results from an event, maybe it's a series of events, set of circumstances that's ultimately experienced by an individual as physically or emotionally harmful or life-threatening. And ultimately, it has lasting adverse effects on an individual's functioning, whether it's mental, physical, social, emotional, or spiritual well-being. That's why when I say when we are traumatized, when we're working with those that are traumatized, we have to understand that trauma impacts mind, body, and soul, spirit, if you will. So we have an event, we have an experience of event, and the effects of those events. And I'm going to come back, and we have to understand one thing about trauma. It's experienced differently by everyone. And I'll revisit that in a minute. Really quickly, I just wanted to kind of hone in on some trauma concepts, if you will. A lot of times we talk about trauma being interpersonal or impersonal. When we're talking about interpersonal, we're talking about relational trauma. We're talking about trauma that's perpetrated by human beings on other human beings. So the pain and hurt is being caused by other humans. It's relational trauma. When we talk about impersonal trauma, generally we're talking about car accidents, weather events, tornadoes, earthquakes. It's, and I always differentiate this, unless somebody is targeting you with their car, generally car accidents is not a relationship issue. Mother Nature events aren't a relationship. It doesn't impact the relationship like interpersonal relational trauma does. I also want to point out we can be traumatized by seeing and witnessing traumatic events, hearing about trauma. I would also add in here reading about trauma. I think some fascinating studies were done after 9/11 for those of us on this call, on this particular webinar, if you will. Maybe some of us can remember 9/11 and the weeks after 9/11. This was prior to cell phones. And researchers were concerned and curious about all of the images of 9/11 that were dumped on the public. And when I talk about images, if you recall and remember, I'm talking about Time magazine, newspaper racks, and gas stations and grocery stores that had images of the planes going into the World Trade Center, people jumping off of the World Trade Center. These images were also on the nightly news of the four channels, the network news at the time. So the images from those mediums were bombarding us. And there were researchers that were curious, what was the impact on young children? at the time, and alarmingly, concerningly enough, and not a surprise news. And I say that as kind of a warning. I'll get back to this later. Um, That was prior to cell phones. That was prior to being able to do 2 or 3 clicks, and I can get into images of suffering, trauma. I can see people die, 2 or 3 clicks on my phone. I'm very concerned about what this device, this cell phone device, is doing to our nervous system and our brains in regards to that, especially given the research from 9/11, which was even prior to the cell phone. The other thing I'll say is the effects of trauma are much worse on younger children than older children or adults. And the reason why is the developing brain. 90% of your brain mass, your final brain mass, is there by age 5. 90% of your brain functioning is in place by age 3. So in the first 5 years of life, if there's a lot of trauma that's occurring, your brain is probably going to be underdeveloped, a little offline. And if your brain isn't online and functioning and developed properly, multiple other systems in your body are also going to be impacted. Digestive, immune, endocrine system, they're all connected. I will say this, the number one buffer, and research shows this through and through, the number one buffer to any traumatic event for any of us, adults, children alike, is social connection, relationships, loving, compassionate, nurturing people that we have in our lives to help support us through whatever trauma we're dealing with. We also have to understand anytime somebody walks through trauma, they are being dealt guilt, self-blame, and shame. It's part and parcel, comes with traumatic events. And like I just alluded to, trauma in childhood really impacts, oftentimes negatively, our neurobiological system, our brain, our nervous system, and other systems that spring off of that. And I said earlier, we all experience trauma differently, even if we went through the same event. The experience of that event is going to be different. The effects of that event is going to be different on all of us. Trauma is a very subjective experience. We all respond differently to it. We bring our history to these events. I use an example. I used it last week. I'll use it today. In regards to the prevalence of trauma, I think some good information can be gleaned from the National Child Traumatic Stress Network. It's a great website for all sorts of information. I encourage folks to check that out if you haven't. But as you can see on this slide, the National Child Traumatic Stress Network, which is a combination of hundreds of agencies across the country, kind of pooled their data. And what you see here is basically 1 in 4 of school-aged children are exposed to a traumatic event. 1 in 4, that's a lot. And many of those kids, it's not just one event. They may be exposed to multiple events, as we'll see in regards to the ACE study. I think one of the things, as I step into talking a little bit about the Adverse Childhood Experiences study, one of the things that this opened our eyes to, I think helping professionals and people who work in the field of trauma, was how prevalent trauma is. And so I think the ACE study also adds a little data, a little knowledge about the prevalence that can be extrapolated. So what is the Adverse Childhood Experiences study? It was a collaboration at the time in the mid-90s, really, between in and around 1994, 95, It was a collaboration between the Centers for Disease Control, Dr. Robert Anda, who was an epidemiologist at the time at the CDC, and Dr. Vincent Folletti, who was a general physician in Kaiser Permanente HMO, Southern California, a huge health insurance if you conglomerate, if you will. And data was collected over 10 years on more than 17,000 people who came in for routine medical appointments. It really was one of the largest scientific research studies of its kind. Um, and data from that is still being gleaned because it's a longitudinal study and they're following these people throughout their lifetime. And so the ACEs study was really a 10-question survey that was handed out to patients who came in for those medical appointments. And they were asked to fill it out. And basically, you see the 10 areas that they were asking about. They called these household conditions or household challenges prior to the age of 18. So at any time in childhood, did you grow up in a house that experienced any of these 10 that you see on this slide? I, the very, the next two slides show these 10 questions on one of the survey formats. I put the link to this in the chat. It should be the first thing that was dropped in the chat. So if you're curious, you can access this. Um, but as you can see, basically it's asking you, if, check it if yes, it corresponds to you. My parents were divorced when I was 6 years old. I would have checked that box, the second one you see on this slide, as a result of that. And those are the last 5 questions on the ACE survey. So again, if you want to see the full survey, not on 2 different slides, you can click on that link I left in the chat for you. And essentially, you're going through those 10 questions. You're checking off what pertains to you. Yes, my parents were divorced. Yes, I grew up with an alcoholic father. And you're essentially adding up how many yeses you checked off. So your ACE score could be 0 all the way up to 10, or anywhere in between. And here are some of the findings from this huge study that was done on over 17,000 participants. ACEs are common. 2/3 of the participants had at least one ACE. Okay. What's more concerning and what really kind of led to some eye-opening results, if you will. More than 1 in 5 participants had 3 or more ACEs. 20% had 3 or more ACEs. What we know and what I'm going to share with you is as the ACE score goes up, our risk for long-term health and mental health problems goes up, essentially, as well. So when we get to 3 or more, 5, 6, 7 as an ACE score, as we'll see, risk factors for a variety of mental health and physical issues start increasing. And I do want to point out, due to social determinants of health, certain populations may be more vulnerable to experience more ACEs. Here's how I interpret that. Your zip code has the most to do with how healthy you are, mentally, physically, and otherwise. Unfortunately, that's the reality in our country. Some zip codes, we can be born into a zip code with a lot of privilege, entitlement, safety, healthcare, food, and we can be born into a zip code that has not much of that. And that really is a determining factor, and I'll talk more about that in a minute. What we know is there is a correlation between ACE scores and the effects on the health and well-being of individuals throughout their lifetime. Um, as you see, problems strongly correlated with a high ACE score. When we talk about smoking, alcohol, drug use, interestingly enough, ACE scores, high ACE scores, are the best predictor of drug use in adult women. In relation to sexual behavior, a higher ACE score leads to riskier sexual behaviors, leads to earlier sex, which of course would lead to teen pregnancy, much higher risk of sexually transmitted illnesses and diseases, and unintended pregnancies. Probably the biggest correlation that came out of the ACE study was depression. As ACE scores go up, depression, the risk of major depression goes up significantly as well. And with that, obviously, comes increased suicidality, increased suicide attempts. Um, and the researchers have also deduced and found out that treatment for the depression is not as effective for those where the depression is really rolling out because of a high ACE score. It's more treatment resistant. In regards to relationships, ongoing victimization, overall, those with a high ACE score, as the ACE score rose, the quality of their relationships worsened. They were more unstable. There was a much greater chance of re-victimization as well as engaging in domestic violence. In the work world, overall, there's a poorer performance in the workforce, more work days missed due to high ACE scores. And really, kind of the meat and potatoes of this study and what maybe we've heard more about is the physical issues down the road with high ACE scores. What we know from the ACE study is that when the ACE scores go up, your risk for heart disease, lung disease, liver disease, injuries, more likelihood of miscarriage, obesity, all of the risks for those goes up as well as the ACE score goes up. Now, I do want to mention, when you think of heart disease, what causes heart disease? And I'll throw out, well, smoking's not good for the heart. Drugs aren't good for the heart. Alcohol's not good for the heart. Well, what causes lung disease? Well, smoking causes lung disease. Some drugs cause lung disease, depending on how you use, the vehicle to use it. What causes liver disease? Alcohol. The reason I differentiate this, just because you have a high ACE score, 7, an 8, a 9, or even a 10, doesn't mean you're going to get heart disease. Doesn't mean you're going to get lung disease or liver disease. There's a higher risk for those, but oftentimes that risk is because of how we chose to cope with the trauma. Some people cope with traumatic events through picking up smoking cigarettes. Some people cope by picking up an alcoholic beverage. Some people cope by using recreational drugs in some way, shape, or form. Obviously, if our coping mechanisms are maladaptive and not healthy in that regard, yes, we're going to have risk factors in our adult life that could come back to bite us, so to speak. But I don't want anybody thinking just because you have a high ACE score, you're doomed. You're going to have all these issues. It really comes down to how we choose to cope. And are they adaptive coping mechanisms or are they not so healthy and maladaptive coping mechanisms? And what the ACE study also showed us this one is kind of all the health problems put together: substance use, depression, suicidality, physical health problems. The ACE researchers have charts for all of those separate. they all look pretty identical to this one. There's a dose response relationship. And what that means is as your dose of trauma increases, your risk associated with that increases, which may lead, obviously, as you see on the left-hand side, the percentage of people with health problems goes up in relation to as the dose goes up. Um, I hope that makes sense because I could show you 10 other graphs from the ACE researchers that all look like this, a linear line that as the ACE score goes up, the risk goes up for associated health problems. I think of fascinating to me personally, especially, well, I think it's fascinating looking at the demographic breakdown of the ACE study. As you can see on this slide, a little bit more in terms of female versus male. That doesn't intrigue me as much as the next one does. 75% of the participants in this 17,000 participant study were white. And the last one, 75% had some college or some college degree or higher. The other thing that's not on this slide is the majority of the participants had health insurance. What does this say about their socioeconomic status? What it says to me is that the majority of the participants in this study were probably middle class or above. And so when I do trainings on the ACE study, what I like to say is the ACE studies an interesting study that gives us fascinating data on how stressed and traumatized white middle class America is. And if white middle class America is this stressed and traumatized, what does that say about every other part of society that doesn't fall into white and middle class? And I'm going to share a little bit about what we know of that other group, those other groups, not the middle class. But to me, as a middle-aged white middle class male in this society, this fascinates me. Um, Not so much that it speaks to me, but it's who doesn't it speak about? That's what's fascinating to me. It doesn't speak about people of color. It doesn't speak about people probably from the inner cities, from communities where there's violence or lacking resources, whether it's healthcare or food. This study still shows how stressed and traumatized middle class America is, white America. There have been additional ACE studies that have been done. I would draw people's attention to the Philadelphia ACE study, and this slide really draws off of the Philadelphia ACE study, and the next slide as well. That really, the Philadelphia ACE study looked at inner city more so. It wasn't contingent upon having health insurance to be able to fill out a survey. They also added other categories, other questions to their survey because they wanted to go outside the household traumas, if you will, those 10 traumas. And so they included, have you ever been discriminated against? Have you ever experienced racism? And to me, I always say too in my trauma and ACEs trainings, you can't talk about trauma without talking about racism in this country. And unfortunately, that is the case. The Philadelphia ACE study added witnessing community violence, living in an unsafe neighborhood, living in foster care. It's amazing to me. Anytime a child has to leave their home and go into another home, that's a huge capital T trauma. A huge adjustment, a huge stress for children. And for children who experience bullying in schools, that's what I would call a toxic stress. But if it's happening every day or most every day, those toxic stresses turn into capital big T traumas, if you will. And so the Philadelphia ACE study, as you can see on this slide, gives us a more expanded look in terms of what they're viewing as challenges or adversities in a child's life. Um, and so what you see on the left-hand side of the screen as you're looking at it is the original ACE study and kind of the breakdown in terms of 0 ACEs, 1 to 3 ACEs, and 4 plus for the ACE score. On the right-hand side is the Philadelphia ACE study results. And I think the biggest thing that you see, or I hope that you see, is the number who reported 1 to 3 ACEs, or I should say 4 or more ACEs, is 37% compared to 21.5% in the original ACE study. There's more childhood adversity when we expand it outside white middle class America, but we also expand the questions that we're asking to get outside the household, if you will. And I love this, a visual, if you will, of these three realms of ACEs. The original ACE study is really what you see in the tree, in the leaves of the tree, are really those, they get at those 10 original ACE questions about household challenges and traumas. What the Philadelphia ACE study did was kind of try to integrate some of what you see down in the community, the roots of the tree, whether it's poverty, food scarcity, substandard schools, structural racism, poor water, air quality, poor housing quality, and affordability. Kind of foundationally, what's at the root of this. So I love that image. And then, of course, we have all these other traumas too that are connected to the climate, the environment, like I had mentioned earlier. So I love this particular visual that gives us a little bit more than the original 10 question ACEs, if you will, ACE survey. And I like this pyramid that shows the progression, if you will, or the mechanism by which adverse childhood experiences influence health and well-being. We can't start with just the adverse childhood experiences. You have to start with historical intergenerational trauma. If we understand epigenetics, which is beyond this training, but traumas passed on generation to generation. There's a generational embodiment. There's historical trauma that we are born with, some of us. Then we have to take into account, like I said, social conditions, local context. What's your zip code? Because your zip code is going to have a huge influence on the privileges you have, the resources you have, and kind of your upward mobility, if you will. And then after those two, then we can take into account any adverse childhood experiences that a person went through during childhood. What we know about adverse childhood experiences is that it disrupts neurodevelopment, neurobiologically. Disrupted neurodevelopment can lead to social, emotional, cognitive impairment, and often leads to a combination of all. And when we are impaired in that way, oftentimes we choose or make the choice to adopt health risk behaviors. And I mentioned that earlier, smoking, drinking, using drugs. Oftentimes, the adoption of those health risk behaviors lead to early disease, disability, social problems, and for some, an early death, because that's what heart disease, liver disease, and lung cancer do. Okay. I do want to say this. ACEs are not destiny. just because you have a high ACE score, just because you've had a lot of childhood trauma, whatever that score is, um, it doesn't mean that you're destined to have health issues, you're destined to die early. It doesn't mean that. Came across this quote, and I think it doesn't kind of, it speaks loudly um, in relation to resilience too. It kind of sets the stage for resilience. The strongest oak of the forest is not the one that is protected from the storm and hidden from the sun. It's the one that stands in the open where it is compelled to struggle for its existence against the winds, the rains, the scorching sun. Now, again, I wouldn't want any child or any adult to stand out all by their lonesome in the scorching sun to build resilience. There are other ways to do that. But the image I get in my mind from this quote fits resiliency. And I'm going to speak just a little bit more about that. Resilience is one of those words, again, if you Google it, you're going to find 50 different definitions. Um, I think most of us has probably heard in some way, shape, or form part of this definition. Resilience is the ability to bounce back from adversity, or as you see in this, rise above, bounce back, using available resources to address the hardship or consequences of the adverse event. And the available resources, as I mentioned earlier, I hope is a loving, nurturing, compassionate adult figure. That we all have those social connections, those resources, at least in the social world, that can help buffer trauma for us. And I like what the ACE research team has provided. They really look at resilience in three different areas: our individual capabilities or skills, and I'll share a little bit more about that on the next slide. Our attachment and belonging. Again, those social connections that I've mentioned a couple times in this training. And the community. Are we connected to the community? Are we safe in the community? Are we connected to our culture, whatever that is? Are we connected to our spirituality if that's something we want to be connected to? So these are really the three spheres, as you can see from the slide, that help protect us, that also help build resiliency. And Anne Maston's quote here, nurturing the healthy development of these protective systems affords the most preparation or inoculation for overcoming potential threats and adversities in human development. Similarly, damage or destruction of these systems has dire consequences for the positive adaptive capacity of individuals. Again, we can go back to zip codes. If you unfortunately were born into a zip code with very little resources, a lot of violence, it's going to impact your capacity to adapt. Well, let me go back because the first thing I'm going to address the capabilities, those skills, if you will, and provide a little more information on what they are talking about in relation to capabilities. And it really comes down to a set of internal and internal skills, external supports, if you will. Do we have as adults, do the kids that we work with or the kids that we have in our families, are they able to regulate themselves? And by regulate, just so everybody's clear, it means emotionally regulate. When we get really angry, can we bring ourselves back to baseline? If we get really fearful or scared, can we bring ourselves back to baseline? Can we regulate our nervous system and calm ourselves, essentially? And one of the huge, as you can see, it's a huge skill to have because if we're able to regulate our nervous system, come back to baseline, it helps to buffer the nervous system. It's a crucial skill. Obviously, Stress management, coping skills that go along with managing stress are crucial. Social skills with peers, being able to make friends, keep friends. Social skills with adults certainly is huge as well for children. Self-esteem, the more foundational we can kind of create a child's self-esteem, get it to a good point, it's going to be a buffer. It's going to help buffer and help resilience within us for children and adults both. And we all need these external supports. It benefits us greatly if we have a supportive family environment when we're walking through traumatic events. Do we have positive and accessible relationships in the community? Whoever that is, coaches, teachers, community centers, the staff at community centers, how positive, how accessible are those relationships? Neighbors, too. External support, especially for adults, secure employment, socioeconomic stability helps us remain resilient when we have those. Adequate housing helps us be resilient. And if you think about it, if you're living in basic needs territory, and what that means is your whole focus is on providing, I need food, clothing, shelter. And if you're struggling, you're going to lose your apartment, you're struggling to put food on the plate for the kids, for the family, that is going to be your only concern. You're not going to be able to give attention to anything else in your life if your basic needs are not being met in some way, shape, or form. I showed this. This comes out of the Center for the Developing Child at Harvard University. It's part of a short video that they had on resilience, which I thought was fascinating too. And I want to point out to folks, excuse me. Number one, this is also where I point out to folks or ask the question. I'm going to ask it rhetorically today because I don't expect a response. Who's more resilient, adults or children? And I'm not talking physical resilience because I know if an 8-year-old broke their arm and I broke my arm, the same place, same bone, that 8-year-old's going to heal a lot quicker than my 50-something-year-old body will. This is not physical resilience. I'm talking about mental, psychological resilience, emotional resilience. Who's more resilient, adults or children? And the answer, I grew up with the myth that children were more resilient. Oh, Billy will be fine. He's a kid. He'll bounce back. They're all right. It's a myth. It's a misnomer. It's misinformation. Children are not more resilient than adults. Resilience is built over time with life experiences. So just that alone, adults are way more resilient than children. Okay. We are also born with kind of a resilience that's set biologically. That's the fulcrum in this. And sometimes, depending on our personality traits, our sensitivity when we're born, our fulcrum can be born in different set locations, if you will, and it can make it easier to tip the outcomes negatively versus positively. And I think what this shows, we can move the fulcrum during our lifetime. We can also, and there's some fascinating research about positive childhood experiences, positive outcomes in childhood, and how if there's enough of those, they can balance out negatives and help build resiliency, if you will. Help this teeter-totter tip in the direction of more positive outcomes versus negative outcomes. And that's essentially what this image is getting at. So tools to build resilience. Stay connected to your hobbies, your interests, whatever it is that speaks to you in that regard. And I cannot stress when I do these trainings, when I talk about resilience, one of the healthiest things you can do for yourself is unplug from electronics, unplug, and obviously stay off your phone. Don't go down rabbit holes in social media. There is a lot of very negative research that's been coming out in the past several years about the impact of social media on our mental health, especially kids' mental health. The research studies that are out there are just showing anxiety and depression going through the roof because of this device and people going down rabbit holes on social media. I'm a firm believer, and I say this, I believe that tech companies, social media platforms are the cigarette companies and oil companies of yesteryear, and we're going to look at it the same way in about 15, 20 years. Um, we don't know what this device is doing to our brain. There are child trauma researchers like Dr. Bruce Perry who are already formulating hypotheses and already involved in studies to get their hands around that a little bit. But the reality is, we don't know what this is doing to our brain. Because, like I said, we can go down rabbit holes with 2 or 3 clicks. If we press on one YouTube video that has images of death on it, guess what the algorithm is going to feed us down the road? More of those same videos. Um, Video games, social media platforms, they know our brains more than we do. They know exactly how to spread out dopamine drops, a feel-good neurochemical in your brain. Video games do this. Games on your cell phone will do this. All in regards to getting you to come back, come back, come back. And it does become very addictive because we want to feel good. And dopamine drops will do that. Don't forget about having fun, laughing on your journey. That can help to build resilience, maintain your resilience. And I can't stress enough cultivating those supportive relationships. Remember, social connections, your number one buffer. Sleep hygiene is crucial. Sleep is a chance for your brain to recharge. Your brain takes a hit when it goes through a traumatic event. Um, and so it needs to reboot. It needs downtime, so to speak. So those are some ways that I really encourage people stay connected with. And I do want to point out, not all stress is harmful. In fact, there's probably numerous opportunities in every child's life to experience mild to moderate, manageable stress. And with the help of supportive adults, this positive stress can be beneficial. That positive stress, those experiences can actually help build resilience. I'm going to give you an example. It's called Fish and Funerals. That it gives you an idea of what I'm talking about. How many of you have memories or can relate to, the county fairs wherever you grew up during the summer? You go to the county fair, they have the gaming section, and every county fair had a booth with little glass goldfish bowls with goldfish in them. And the object was to throw a ping pong ball into one of the jars. And by gosh, if you did, the worker would get out a Ziploc bag, dump the water and the fish into it, zip it up, give it to you, and by gosh, you're carrying a little goldfish around for the rest of the evening. And what usually happens most of the time is 2 days later, that goldfish is belly up and ultimately flushed down the toilet. Here's a different idea for caregivers and parents. Use that opportunity of the dying goldfish to make it a mild, manageable stress where you can tie routine around it, kind of a ritual around it, grief, instead of flushing it down the toilet, why don't you and your young child put it in a little box, take it out into the backyard, dig a little hole, have a funeral for this fish, have a service for this fish. Generally, kids don't get too attached to fish. I wouldn't suggest doing this with a family dog who's been in a child's life for 8 or 9 or 10 years. No, there's a reason why it's funerals and fish, not funerals and other pets. But I think you get the idea. We can take those opportunities, walk hand in hand through this mild or moderate stress with children. We do this all the time when they have tests at schools, papers due at schools. If we can be there to help them step through those mild, moderate stresses, it's going to help build their resilience. Because over time, both our bodies and brains begin to perceive these stressors as increasingly manageable. We become better able to cope with what life throws at us, both physically and mentally. However, when adversity feels overwhelming, when supportive relationships are not available, stress can turn toxic and tip the scale more towards those negative outcomes. Okay. Well, I am back. I know we've got 5 minutes left, and I can certainly stay on longer. Um, but and I haven't even taken a look at the chat. I just didn't even know if there were questions that came up.
Yes. So I know that some people have been asking if the PowerPoint will be shared, and that will be shared. You'll get a certificate, and this will also be posted on the Chestnut Health Systems website as well. Um, I am looking through the chat to see. Um, so Pam asks, what about kids who are moved around their entire life? Example, I attended 12 different schools from ages 5 to 15.
Yeah, Pam, I can relate. Did a lot of moving as a child too. Again, it wasn't a part of any ACE study, but that is a huge stress for a child. And if you're talking about moving 10 to 12 times, to me, even if it's a little T trauma, not a capital T trauma, but the fact that it happens 10, 12 times turns into a big T trauma. That's my view on that. What you're talking about is traumatic for a child. Yeah.
Do the adverse effects necessarily go in the order?
Do they go in any order? Did I hear that
Or in
correctly?
the, I guess, so Nina asked, do the adverse effects necessarily go in that order?
No, no.
Okay. Stephanie asked, is the fulcrum like the window of tolerance?
Yeah, I saw that one. That's a good question. It's not something that I would equate or I've ever equated to the window of tolerance. The fulcrum, although much like the window of tolerance, we can, just like I said, you can move the fulcrum, we can increase our window of tolerance. Okay. We have that ability to increase the window of tolerance, but I wouldn't equate the fulcrum necessarily to exactly the window of tolerance, at least what you're speaking of.
Awesome. And then, um, when they were in person last week, were you able to find any information on the relationships between neurodiversity and ACEs?
Oh no, but I remember that question quite well. Um, I wish I could get back to you on that one today. Great question. Is that from Colin?
It is, yes.
It is. No, great
Yeah.
question. Alan, I've been too busy this week. Although I did do a couple Google clicks, if you will, to at least get the ball rolling on that. So yes, follow up with me, Colin, at a little later date. Great question.
Okay. Thanks. Stephanie asked, what would you recommend for someone who has developed insomnia from their trauma, knowing how important sleep is and yet how out of reach it can be from our control?
Yeah, no, I mean, and this isn't because I was trained as a therapist. I think if you know where that sleep disturbance is coming from, um, and you feel it's connected to trauma, there are therapeutic trauma evidence-based things that can be done in a therapeutic environment that can help to alleviate trauma symptoms. EMDR is just one of those evidence-based single episode trauma that has a lot of effectiveness, great results in terms of alleviating symptoms, sleep being one of them. Um, but in regards to that, people, it's such a great question. People oftentimes rely on medications to help them sleep. Um, and that, for a short term, I would say go that route, but I wouldn't want to long term be a pill popper if I could help it. That's why I encourage people reach out to a trauma kind of expert. If you're going to a counselor or therapist, ask about their trauma background, ask about what trauma models they can utilize. Yeah, that would be the direction I would encourage.
Awesome. And just keeping note of time, it is 12:30.
Yeah.
So if you do have to hop off, you are more than willing to. Like I said before, Randy is going to send out certificates for participating in today's webinar. You will also be able to see the recorded webinar online, and that will be posted on Chestnut's website. And the PowerPoint will also be shared. Randy has sent in the chat the survey link, but that will also be shared as well over email.
And
If you are,
Grace,
yeah,
yes, I will email Randy the PowerPoint this afternoon. And so then, yes, that can go out as well. Yeah.
awesome. And then you can also, we'll share that link to the one pager that you sent earlier before we started.
Oh,
I
what was,
think,
yes, 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 yes. That
mhm,
that link. Yeah.
yeah. For those who are able to stay on, we'll take a couple more questions.
I
So,
Yeah, I
uh,
just saw some of the chat kind of going by. Somebody had recommended or mentioned that CBT can be useful, cognitive behavioral. Trauma-focused CBT is evidence-based. It, I agree, it can be a very useful tool for adults. I don't find that cognitive behavioral treatment works as well with younger kids in any way, shape, or form because cognitively they're not developed enough to use that model. But if it's adults you're talking about, definitely trauma-focused CBT, cognitive behavioral therapy, um, is certainly beneficial, could be beneficial for older teenage kids and adults. So yeah, I just wanted to qualify that.
absolutely. Um, so Savannah asked, we focus a lot on educating parents and kids about building resilience. What strategies have you found most effective in getting parents to truly engage in the conversation? Oh no, I just got rid of it. I clicked away. No, wait, come back. Okay, we're back. We'll start again. So we focus a lot on educating parents and kids about building resilience. What strategies have you found most effective in getting parents to truly engage in the conversation and see the value in ACEs/PCs?
Wow, that's a really good question. And I wish I had a really, really good answer for you in terms of engaging parents. Because I think, if you're a therapist, if you're a counselor, one of the struggles that you have is engaging the caregivers. A lot of times, caregivers, parents want you to fix the children. and they don't want to be a part of that fix. Um, I think and again, I don't know what your role is, Savannah, but if your role is working with these parents, one thing that I try to do up front, or I did when I was doing direct therapy services, was informing the parents right off the cuff, I cannot fix your child alone. I can help your child with your involvement, maybe the other siblings' involvement, as well as your child. I'd put that out front, but again, it's hard for me to know what role you are in. Um, but that's kind of because I wanted to kind of nip in the bud right away, the parents, caregivers thinking, okay, this is all about the child. My experience is trauma is not all about the child. Trauma is about the family system and how the family system's responding. Sometimes just getting a sense from caregivers what their own trauma history is in a gentle, non-threatening way can be eye-opening for caregivers too. That's a little more tricky, and there's more of an art form to kind of going down that road in a therapeutic setting with a caregiver. Because obviously we don't want to re-traumatize people. The point is not to add more stress, but we do want to increase self-awareness. Yeah.
Awesome. Thank you. Is it Jill asked, is it common to have a childhood trauma beginning at age 3 to have trauma resurface after years of therapy, say around age 24 after seemingly all healed?
Yes. It's common for children as they go through different developmental milestones. So a 3-year-old who was traumatized went through therapy. They may have kind of found baseline, been okay for a few years, and all of a sudden they have issues again at 8 or 9. And then all of a sudden you get that squared away. Then teenage years hit. Then they have issues again. The reason being their brain is developing, they're viewing the trauma differently as they get older. And by viewing it, feeling it differently, they're going to have different reactions, even into the 20s. Our our cortex, prefrontal cortex of our brain, our human brain isn't fully developed until 25 or after. And so, yes, that's not uncommon, even in early adulthood, like you suggest there.
All right. And we have one last question. So Nina asks, I have a parent who is struggling with their child with an extreme shame reaction, and I'm trying to help her with it. Do you have any tips?
Yeah, don't add any shame to that life. And I say that, and I don't say that jokingly. One of the things I say to folks, when you're working with anybody who's traumatized, don't shame, don't embarrass, don't humiliate, because all that does is increase that shame response. A shame reaction is a complicated reaction and probably way beyond what I can offer you here. But if you're working with a child who has this extreme shame reaction due to trauma, I would definitely recommend a child trauma therapist. Um, Definitely to help with that.
All right. Well, thank you, Keith, for your time. We very much appreciate it.
You are very
Again, there's a survey in the chat. If you have the time, go ahead and take it. Randy will be sending that out as well. PowerPoint will be sent out, and the recorded webinar will be posted on Chestnut's website. You guys have a great rest of your day.
Thank you, Grace.
Thank you.